Welcome back to ABC 7 at 4. I'm Mark Ross. Well, tomorrow is World Hepatitis Day. That is a day that aims to raise global awareness of a group of infectious diseases known as hepatitis A, B, C, D, and E, and encourage prevention, diagnosis, and treatment. ABC 7's medical contributor, Dr. Ogechika Alozie with Sunset West Health, here to talk about hepatitis. Doctor, first off, tell our viewers, what is hepatitis?
Well, at the end of the day, hepatitis is a group of viruses. Like you already said, there's A, B, C, D, and E. We really don't talk about the D and the E. There's a coronavirus. Some are double-stranded, single-stranded. The important thing is that all of them cause different disease states, and that's what we're going to talk about.
All right, and we know that there are like 100,000 new viral hepatitis A, B, and C infections in the U.S. every year.
Yeah, it's really interesting. So we'll talk about the transmission, but it covers the gamut in terms of how people get them, what it affects. Primarily it's the liver, and so most of the hepatitis C's cause some sort of cirrhosis or liver damage, and some of them may just cause what's called an elevation of liver function tests or liver enzymes.
And there are vaccines, though, available to treat hepatitis A and B.
Yeah, so Twinrix is the most common vaccine, which is a combined vaccine that treats hepatitis A and B. You can also get them individually. Most people that work in healthcare have gotten this at some point in time, and so we look at different antibodies and virus levels, but the important thing is you can protect yourself against those, and then we'll sort of focus in on hepatitis C.
Now, how are the different types of hepatitis spread?
Well, hepatitis A is what's called fecal-oral, or really bad food, bad hand hygiene. And so people get it when they travel sometimes. You come in outbreaks where somebody has not washed their hands with preparing food, and that's kind of gross, but it is what it is. All of them can be transmitted sexually, but specifically B, C, and D can not only be spread sexually, but also by IV drugs or contaminated needles.
And the one type, of course, we hear the most about is hepatitis C.
Yeah, and so hepatitis C affects 3.5 million people in the United States. There's been an increase recently, which is unfortunate because we've had great treatment for about the last 10 years, and people are getting younger and younger that are being affected by it instead of getting older, and that's unfortunate as well.
And of course, what we mentioned going into the break was the challenge that people have of paying for hep C drugs.
Yep. So once upon a time, this was treated by giving what's called interferon plus ribavirin, and it made you really sick, and you got it for months and months, and it worked about 20 to 30% of the time. The new drugs are called DAAs, or direct-acting antivirals, work excellently. They cure people at a 95 to 99% rate, but they can cost up to $100,000 for a 4 to 8 week course. The good thing is organizations like myself and across the city are able to get these medications, and they can cure people. And so now we sort of look at it, 1 in 3 are cured overall. The unfortunate thing is if you don't have insurance, just like with everything else, it affects it, right? If you're under the age of 40, it can affect it. And if you're under the age of 40 and without insurance, that can really be the worst case scenario.
Finally, some resources if viewers have more questions. And look at that. Sunset West Health is one of those resources. What a coincidence.
Yeah, I mean, we try to do a really good job at treating viral infections across the board. We're experts and excellent in treating hepatitis C. We partner with a lot of the gastroenterologists around the city, but we're not the only ones, right? And so whether it's the City of El Paso Health Department, Project Vita, LaFay Care Center, a gastroenterologist, and there's a number of them across the city. Again, if you think that you've ever been infected, you should go talk to somebody, but more importantly than anything else, get vaccinated and get screened.
ABC 7 medical contributor Dr. Ogechika Alozie, thank you very much.
Thank you, sir.